businesses and 10,000 lives, of which 20% previously had no major medical coverage. Additionally, the program has resulted in a 10% or less average annual increase in premiums. Not only have we satisfied the need for many uninsured, we have also saved our members money and did so without a single tax dollar. We respectfully urge you and your colleagues to continue slowing this process and allow for a more thoughtful, careful, and studious approach to change our nation's healthcare system. Based upon our experience with a private, cooperative-based plan, we are sure that healthcare reform legislation must continue to allow for the formation and competitive sustainability of innovative private sector solutions such as ours, again, without the expenditure of any tax dollars as our co-ops are doing. Further, while our particular model has been successful, any legislation concerning healthcare cooperatives must allow for a privately run cooperative such as ours and not serve as a backdoor approach to a public health plan option. And as a reminder, these types of cooperatives are privately run by their members with little government intrusion or burdensome regulations. Are concerned about a number of features found in the current legislation which would hurt our co-ops as they currently exist. The first one, the small business surtax, could devastate 6 out of 10 small businesses. The Tax Foundation recently found that this surtax would push the top marginal tax rate over 50% in 39 states. Small businesses have led America out of the last 7 recessions and already struggle with unreasonable government regulations and taxes. Putting the cost of this reform on the backs of small businesses make no sense, particularly when the Congressional Budget Office says the legislation would send the U.S. into deeper debt and have little or no impact on the nation's current healthcare woes. Any mandate to employers that requires them to offer a one-size-fits-all minimum benefits package or pay-or-play program to all of their employees is the wrong idea. An employer mandate would be a job killer, raising the cost of maintaining a workforce, as recently expressed by business owner and Chamber Board Director Darren Camp, and I quote him, "Small businesses and our consumers will be the ones who suffer heavily if Congress passes the health care reform bill. Not only will we be forced to cut back employees, which will result in poor service for our consumers, but we'll also have to tack on the expense of health care onto our products, making our consumers pay more." It is estimated that given the government plan option, 130 million people would move from private to public insurance, and these sheer numbers, combined with basing a public option on Medicare reimbursement levels to providers, would ultimately shift costs to the private sector. As well, a government or public option which would be an unfair competitor with the private sector would eventually lead to a government-controlled single-payer system, since the playing field would not be level. If another Washington bureaucracy was to make healthcare decisions, businesses would have even less control and leverage over cost. The Lubbock Chamber is opposed to an unelected, unaccountable federal bureaucracy making healthcare decisions that should stay between patients and providers. We certainly support healthcare reform and believe it is needed, but not on the backs of small businesses, and certainly not in a manner that would be detrimental to the U.S. economy. Further, if Congress passes these policies as part of reform legislation, it could adversely affect innovative private sector solutions that already work, such as our Chamber Employer Healthcare Plan. We are very grateful that this panel has sought our input. We urge you and your colleagues to consider America's small businesses as you finish your work toward a well-thought-out, meaningful healthcare reform. Thank you for your service to Texas and our nation, and again, thank you very much for this opportunity.
President Obama, Newt Gingrich, Hillary Clinton, a lot of other people have said that we need to modernize our healthcare system with electronic medical records and other technology. Interestingly, one of the pioneers in this area is already doing what they think should be done, and he's right here in Plano, Texas. Please give a warm welcome to Dr. Christopher Crowe.
Thank you, Dr. Goodman, and thank you all the Congressman for inviting us. Sam Johnson, a friend of our practice. My name is Christopher Crowe, I've said, and I'm a family physician in Plano, Texas. I'm president of Village Health Partners, which is a 10-provider group of family physicians. We take care of about 25,000 residents here in Collin County and the surrounding area, so there's probably a good chance that some of you are members of our practice, and I applaud you for being out here tonight. I'm also a small business owner, so I actually wear two hats, I guess, on the stage. We employ about 30 people in our practice and about 100 around the medical village you're about to hear about. When I became a physician and opened my own practice about 9 years ago with my single partner at that time, it became quickly evident that if we wanted to be a viable practice, we really had to start thinking like a businessman. Unfortunately, certainly we don't learn that in medical school residency. This meant learning how to streamline workflows and automating things and eliminating waste. And, so we were one of the early adopters of electronic medical records 6 or 7 years ago. Leveraging technologies like this allowed us to not only cut down on our costs, but really where the holy grail is cutting down on medical errors and really improving quality. So today, 6 years later, fast forward, I can give myself and my practice fellow physicians feedback that allow us to have some incredible preventive care numbers when it comes to like mammograms and colon screens, as well as disease states such as diabetes that are far superior than the national averages. So that was a great start. And that's what we did until about 3 years ago when we decided to take this to another level. 3 things made us decide to go to what is now called Legacy Medical Village here in Plano. One is that we became very frustrated, as many of you are, I'm sure, with the fractured healthcare delivery system. Seeing patients day to day in my office was very, very efficient, but once they left my office and had to get services and specialists coordinated, it was very frustrating for myself and my staff, and taking up a lot of our time. I'm sure that sounds familiar to you. And even if we did get patients where they needed to be, communication still became hit or miss. The second thing was that I started looking at a lot of national surveys of patients and seeing what they said about what they wanted in their doctor. And surprisingly enough, nowhere on there was how smart I was or where I went to med school or how well I was doing at diabetes. It all was around, number one, access to care. They wanted to be able to see their physician when they wanted to see him, when they needed to see him. The second was they wanted convenience in their health care, and third was communication. Usually in that order, access always be number one. So we thought to ourselves, why don't we build something like this? Furthermore, study after study showed that in areas of our country as well as areas around the world, anytime you have a high concentration of primary care physicians, you're seeing lower costs and higher quality. So that kind of gave us the feather in our hat to consider that maybe we could do this. So we set out to create a Legacy Medical Village, which offers a one-stop shopping experience for a wide variety of commonly needed outpatient services, all at one convenient location. We've been open a couple years now and are still growing very much so. The village is based on the shared philosophy of 3 things. This is going to sound familiar: open access, convenience, and communication. Primary care is the foundation of Legacy Medical Village, and all the specialists and services are invited in by us. And not only because they provide great quality care, which we can recognize, but also they agree to work in a delivery model with a shared philosophy of access, convenience, and communication. We now have about 25 specialists and services in Legacy Medical Village and about 100 employees throughout. We're open nights and weekends, and we have online services to address the access. I think just a couple of short examples to maybe make you feel what it might be like for a patient experience. This should sound very familiar to you all. The first is preventive care. Take a 50-year-old diabetic female who's coming in for her annual checkup, and maybe she's a smoker to add on a little extra. This would require, in general, for those of you in this situation, if you're an employer, you know this, they need a physician office visit, chest x-ray, lab, pap smear, mammogram, bone density, eye exam, and colon screen. That's a lot. That's just for your preventive care. They're not even sick yet. At Legacy Medical Village, you're going to come in and see your doctor. You're going to get your exam, you're going to get your diabetes managed, you're going to get your pap smear and your blood work done, and you go downstairs and get your mammogram, your bone density, your chest x-ray, then you go across the hall, and if it's that time, schedule a colon screen without an office visit with that physician.